Imagine you're a patient facing prostate cancer surgery. While the procedure aims to save your life, there's a big concern: erectile dysfunction. It's a side effect that affects up to 95% of men right after surgery, and for many, it lingers for years. But what if doctors could predict this risk beforehand? That's where this groundbreaking study comes in, exploring whether MRI scans before surgery can forecast ED, giving patients and doctors better insight to make informed decisions. So how do they do this? Let's break it down. The research team tested 4 models to predict ED risk. 1. Clinical data alone, factors like age, pre-surgery erectile function, and medical history. 2. Handcrafted MRI features, manual measurements of anatomical structures, like the thickness of the periprostatic fascia, a thin tissue layer around the prostate. 3. Deep learning models, AI that learns from MRI images directly without manual input. 4. A hybrid approach combining clinical data and MRI. The study analyzed data from over 646 patients, carefully excluding 139 with incomplete records. To ensure fairness, they used a consistent testing framework, training models up to 400 times with a powerful GPU and the atom optimization algorithm. For segmentation, identifying prostate regions in MRIs, the best-performing model, nnU-Net, excelled at locating the mid-prostate but struggled with the apex, where anatomical details are less distinct. Now the big question: how accurate were these models? The clinical-only approach had an AUC, area under the curve, of 0.663, while MRI-based models scored slightly lower at 0.569. But here's the twist: when combining MRI with clinical data, the improvement was minimal. However, the MRI models focused on anatomically relevant areas, like the prostate and nerve bundles, suggesting they're capturing meaningful patterns. Why does this matter? Even though MRI didn't outperform clinical data, it's not a dead end. The study shows MRI could enhance future, multimodal systems, where doctors use both clinical insights and imaging for a fuller picture. Think of it like a team. Clinical data is the foundation, and MRI adds a layer of detail, especially as AI and imaging tech advance. But the real breakthrough came from AI's ability to detect subtle markers, like the thickness of the periprostatic fascia, which previous studies linked to nerve damage. By identifying these patterns early, doctors could adjust surgical techniques or recommend therapies to preserve function. This isn't just about prediction, it's about personalized care. Imagine a future where a patient's MRI scan, analyzed in minutes by AI, gives a clear roadmap of their recovery chances. That could mean fewer surprises, better counseling, and treatments tailored to individual anatomy. Of course, this is still early research. The models need more testing across diverse patient groups, and doctors will always balance data with human judgment. But the results are a glimpse into a future where AI isn't just a tool for diagnosis, it's a partner in empowering patients to take control of their health. Thanks for watching. If you found this insightful, hit subscribe for more deep dives into medical science. And let us know in the comments, what other health topics would you like to explore? See you next time.